My name is Mrs. Joy Rugano Wachira, and I am a counselor psychologist, but that's not where I started. My background is nursing, where I have practiced for many, many years, over 30 years in total, from training to the time I hung the boots, and worked in hospitals, clinical experience. And one of the things that drove me to being a counselor is we'd have patients who have deep, deep needs where they need to a nurse, to talk to a doctor. And most of the time, with the amount of work in the ward, we were always on our feet throughout. And I found that really a patient had no one to talk to. So this started giving me interest in counseling, and eventually I did a psychology undergrad, which I followed later with counseling psychologist, and that's where I am today. Today we are talking about mental health. So I'll now talk about the type of people I meet in my profession, and I'll just share a case study, maybe one or two. And now let me first put a disclaimer. Depression is very common in the world that we live in today. But as a counselor, if you come to me and I assess you and I see you've got all the signs of depression, we know them. We have a manual that guides us, and if you are a counselor, you're a psychologist, you know it. It's called DSM-5, and I see you fall into that category. I'm going to use a tool, for example, Beck's Depressive Illness Inventory, and then I will score you. And if you have severe depression, I will refer you to a psychiatrist who will first see you, and then when the depression has lifted, that's the time I'll be able to sit down with you and I'll be able to counsel you. Because when the moods are very down, even if we try counseling, it does not work. So I'll give a case study of one of the patients I have seen. She came with mild depression, and it's a very sad story because this lady had talked to her sister, and the sister is the one who referred her to me. And what happened is one night when she was sleeping with her two daughters, some thugs came in, and when they had taken what they wanted, one of them went to her bedroom and raped her and told her, "Do not scream." And by the time she was coming to me, she was in a very, very, very bad state. So we talked it over, and as a counselor, you are privy to people's information that probably they've never told anybody else in this world. But we are guided by ethics of confidentiality. So even as I share, I'm not going to mention any names. So when she came, she was able to share with me and tell me things probably only her and I know. And she told me in her younger years, when she was in primary school and secondary school, she had been violated. And now it had happened again. And the big question was why? So when a person like that comes to see a counselor, I think one of the first things we do is try to give them hope. Tell them they were able to endure the first one and the second violation, and they are still here. And they have strength to be able even to overcome what is going on. And for them to know that it's not that they've done anything wrong, that they are being picked every now and then. Because those negative talks can overwhelm them, and they feel they are not worth because only bad things are happening to them. And if they go into bad depression, those are the people who can even take away their life. She had also stopped working. She wasn't getting out of the house because everybody now out there, especially men, just looked they were going to violate her. So it's try to encourage her, get out. The world is not that bad. Get out maybe with a friend one day. Go with one of your daughters and let them escort you. Tomorrow, just slowly, and she was able to go back to work. And as we speak today, the lady is back to work and going on with her business and taking care of herself. And some of the things we also talked about was how can we minimize maybe being attacked later. Although they found her in the house, one of the things we said is trying to get to the house in good time. She doesn't use any substance, but so if somebody uses substances, try to encourage them not to use substances. And so it was a successful story. Another person, I saw another lady, she came to me, and as we talked, there was something also came up. And I think what had brought her to me was just the tip of the iceberg. And after the session on her way out, she said, "Counselor, there's something I haven't told you that I'd want to tell you about." And I said, "Okay." So she said, "When I was a little girl, I was violated by my cousin, and I never told anyone. But now my concern is my sister has small girls, and the cousin still lives within the vicinity, and I'm fearing the same thing might happen to my nieces, the same thing that happened to me." And so I told her, "Okay, this happened a long time ago, so let's see, from your experience, how can you help your nieces from that experience?" And on deliberation, we came up with a plan. She'll go sit down the little girls and we'll tell them, nobody should touch you here, there, wherever, and if somebody does so, you come and tell me. So that's empowering the little girls. In my career, very many years ago, I remember working in a certain institution. And there was this young girl who was there again. I'm sorry, my cases are many to do with violation, but it can tell you what happens to women when they are violated. Something that's done, but it lingers on, and it seems to affect ladies so much. She had been violated. This was a young girl who was in her teens then. She had been violated, and now she was in this mental institution, hospital. And the pattern was like she'll be very, very happy in the institution, but every time she was discharged home, she never lasted a month. She would always come back to the institution. The reason being, every time she went home, the guy who had violated her was living in that community, and every time she saw him, she had this what we call in post-traumatic stress disorder symptom as reliving the experience. So it would seem like she was being violated afresh, and she would end up in hospital. The best way to deal with that, take care of the violator, which unfortunately by the time I was done with the institution, I don't know that was done. But the best thing would have been to deal with the person, and this girl's issues would have been sorted out. Or maybe if the worst comes to the worst, relocate, if possible, and go start life afresh somewhere. So there are all these issues. Some we handle them in counseling level, others we have to hand them over to our psychiatric nurses and to our psychiatric doctors. So in Kenya, where are we now with mental illnesses, with counseling? For me, I'll talk more on counseling. Counseling, it's taking off in Kenya. Are we where we are supposed to be? No, we are not there. Because unfortunately our society, when people feel unwell, they'll go to the hospital, and there is where they are going to be treated. And when they come to see the counselor, I think they come with that mentality, it is do's and don'ts, which is very far from what counseling is. Counseling is talk therapy. You come with your whatever issues they are on, we explore them, and we empower you. You come up with our guidance, come up with a formula on how you are going to cope with what you are going through. So it works. It's something that many people should get engaged in. Even once in a while, just talk to a counselor about what's going on in your life, in the workplace, with your friends, all that. It's very, very healthy. And even us as counselors, we also have our counselors. We go for what we call personal therapy. Like if I have got a very difficult case that I'm dealing with, I will go and see my therapist. And we are able to go through the case, and I'm able to tell how I'm feeling or him. And then he's also able to doctor the doctor. So I'd encourage people to get involved in counseling, especially in these days when especially our young people are engaging in substance use and abuse. Not just to write them off, because there is nothing, no behavior that comes from space. A behavior is always informed by something. It could be peer pressure, it could be trauma in life which you don't have any other way of coping with it unless you use drugs. And so before we write our young people off, it's always nice to sit down with them and talk with them, not to them, talk with them. And as a parent, sometimes we are not able to do this, hence the need to refer them to a counselor. So I look forward to a Kenya, to a nation, when I'll see more people come to see the counselor instead of going to the hospital if their symptoms warrant them to see me. Thank you.